Hi, everyone. Welcome back to another edition of Healthier You here at Oswego Health. We're so glad you joined us. I'm so excited this month to be able to talk about women's health. We have talked about men's health, colon health, mental health, all the healths. And today we get to talk about women's health. So we're so glad that you were able to join us. I'm excited to bring to you this panel that's with me today. I'm Katie Peglaroli, Director of Integrated Healthcare at Oswego Health, and I'm joined today by our breast surgeon, Dr. Lisa Lai, our Raj Mahajan, Dr. Raj Mahajan, he's Oswego County OBGYN, Dr. Alex Banashkevich, he is with Upstate Oncology, and Carolyn Handville, she is the OCO Cancer Services Program of the North Country. So an all-star cast as we answer your questions. So if you have a question, don't hesitate to put one in for us. And we're going to say thank you all for taking the time to join me today as we talk about this important women's health. All right, Dr. Mahajan, I'm going to start with you this morning. Everyone needs to make sure that we start those screenings and healthcare early. We have primary care physicians, but in women's health, when would be the first time that a woman should consider going to see an OBGYN?
Well, I think really when they start thinking about having a family, when they're concerned about irregular bleeding, when they start to become sexually active, or they have any other concerns that their other doctor can't help them with. I mean, in general, when do you need a pelvic exam? You need a pelvic exam when you turn 21, or when you become sexually active, or if you have complaints or concerns that we can't figure out without doing a pelvic exam. I think that a lot of time people come see an OBGYN early because they have irregular bleeding. I mean, adolescents have irregular bleeding. We do things to evaluate and treat their irregular bleeding. A lot of times we can do that without even doing a pelvic exam. Sometimes just with a history and some careful trial and error with medications, we can make things better.
Great, thank you. Good tips for us as we're trying to decide when that's right. Dr. Lai, I'm going to go to you, and we all know we're living in a pandemic era. And with that, a lot of women have missed some of their yearly exams, mammograms, for example. What's important? Why is it important for us to get back on track with those things?
Good question, Katie. You know, we looked into this and noticed when we looked at the number of patients coming for screening here at Oswego Health that we were down about 20% in 2020 going into 2021 due to pandemic. So that's about 20% of our patients that we would ordinarily catch with cancers that are likely undetected at this point. And the key to having a mammogram is that it can detect a cancer in its earliest and most treatable and curable stages. So the earlier you find it, the better the patient's going to do, and hopefully even the less treatment a patient is going to need to get a good result. So, you know, if we wait until that mass becomes palpable, it's certainly going to be more advanced, and then it's going to be more for the patient and everyone else to go through.
Great point. So ladies, get your mammogram scheduled. We're here. That's going to bring me to Carolyn. Carolyn, North Country Cancer Services Program. It's a really great resource for our community. Maybe you haven't had a chance to have a mammogram before and you need more information. Can you explain what cancer screenings fall under your program, and how can someone reach out to you?
Absolutely, Katie. Thank you. Coming off Dr. Lisa Lai saying 20% decrease, we can't negate the fact that some of you folks may have lost your health insurance during this pandemic. I'm going to start right off by saying you can reach me or my fabulous staff with one easy phone call to 592-0830, and then go into why do you call the Cancer Services Program. As Katie had mentioned, we are a great resource, life-saving to those that are uninsured. We offer free, yes, free, breast, cervical, and colon cancer screenings to the community who, again, are uninsured. We do have age guidelines, but again, it's one quick phone call to our program, 592-0830, to see if you're eligible for your free cancer screenings. While you have me, I'm just going to quickly say, in addition, we do offer diagnostic services. We can even provide coverage for those diagnosed with breast, cervical, and colon cancer. One quick phone call, we can schedule you with one out of almost 100 different medical providers, including Oswego Health, and we can pay for your screenings.
Great.
Back to you, Katie.
Yeah, that's so great. And so there goes all of our excuses, right? The other thing with getting on the schedule and right now with healthcare services, you know, it's important to get on that appointment, and it might be a few weeks out, but it's still able to get in at the earliest that you can. So we're encouraging you to do that. All right, Dr. Banashkevich, to you. At Oswego Health, we're really, really proud of our partnership that we have with Upstate Cancer Center. What treatments are available through Upstate Cancer Center to our community?
Yeah, thanks for having me, and yeah, I'm happy to be here. So here for the last 7 years, but very proud to be here. And Oswego County is very fortunate, I think, to have access to cancer care, academic cancer care within a small community by extending Upstate Cancer Center here. So I'm radiation oncologist. So with respect to radiation, we offer the latest technology and the latest treatments, so people do not have to travel outside of the county and can be treated close to home over several weeks to several days to several weeks. We also have medical oncology right on the site in Oswego Hospital. So again, for latest in systemic therapy, including immunotherapy, people do not have to travel far. All is available close to home.
Great, thank you. I think that's just a great example, if you're catching this today or seeing it later, of all the partnerships that we have here in Oswego County. It's about Oswego Health. It's about community providers coming together as we work together to make that truly healthier you. A couple questions from our community. Dr. Mahajan, I think I'm going to tag you here. First one, why should my daughter receive an HPV vaccine, and when would that be appropriate?
Okay, well, HPV vaccines are really important. They prevent cervical cancer. They prevent precancerous changes. Generally, we recommend getting your HPV vaccine at age 11 or 12. Girls and boys get these. It also prevents most anal cancers, as well as a lot of the cancers of the mouth and throat. They're caused by HPV. So that they recommend getting your vaccine at age 11 or 12. You can do it as early as 9. People who start them before age 15 only need to get 2 shots, 1 vaccine and then 1 vaccine 3 months or 6 months later. People who get them over 15, and they recommend getting them between 15 and 26 also, have to get 3 shots. In general, you want to get this before you're sexually active. HPV is generally a sexually transmitted virus. And the best way to get protection against this is to be vaccinated before you're exposed to this virus. People can get it at ages greater than 26. You may have a more difficult time with insurance companies covering it, but it still will protect people who haven't been exposed to those viruses really any time in their life. But it's more difficult to cover as you get older. But definitely guys should get this too. It protects against anal cancer. It protects against a lot of laryngeal cancer, throat cancer, and it also protects their female significant others from getting cervical cancer, and vaginal and vulvar cancer too.
Great information. I think that was, something I wasn't aware. Girls get it, boys can get it. It helps with other cancers. So thank you very much. Second question, also gonna for you as well. Certainly, Carolyn just gave us information about how to do this, but who's at risk for ovarian and cervical cancers, and what age should we start screening for those?
Okay, well, that's another great question. Cervical cancer recommendations keep changing. There are a couple different ones, but generally cervical cancer, most of it is caused by HPV, a sexually transmitted virus. We used to screen people at a really young age, and we found out that young girls and adolescents have very transient precancerous changes. They come and then they go away on their own. So depending upon whose recommendation you believe, some people recommend screening at age 21. Others recommend screening at age 25. We screen by both doing pap smears, looking at abnormal cells on the cervix, as well as checking to see if people have a high-risk HPV virus type. These are the big things that we look for. And then after that, try to figure out if the precancerous changes are likely to go away on their own. A lot of them do. And if not, then we may do something to treat them to make them go away. Again, if we can get people to get HPV virus vaccinations at an early age, a lot of people won't get this. As far as ovarian cancer goes, ovarian cancer is caused by a bunch of different things. First thing is as women get older, they have a higher chance of getting ovarian cancer. Certain people have genetic predisposition to getting ovarian cancer. There are different gene mutations. Two of the more common ones you hear about are BRCA1 and BRCA2, the breast cancer genes that also increase your risk of getting breast cancer. Women with a family history of ovarian cancer are at increased risk. People who are overweight are at increased risk of getting ovarian cancer. Women who go through menopause and are estrogen replacement are at increased risk of getting ovarian cancer. Women with endometriosis also have an increased risk. When people get periods for a long time, that increases their risk. So that if you have very early age where you start getting periods or a very late age when you stop getting periods, those both increase your risk of getting ovarian cancer. And people who've never had babies are at increased risk. We think actually being pregnant because you have fewer periods seems to protect you against getting ovarian cancer. Things that also protect you, birth control pills dramatically protect you against ovarian cancer. And we think that most women who get ovarian cancer have it start at the end of their fallopian tubes. So when women are done having kids, if you take out the end of their fallopian tubes, that dramatically reduces their chance of getting ovarian cancer. For most people who are low risk, the average chance of any woman getting ovarian cancer is 1.4%. One woman out of 70 will get ovarian cancer. So for people of normal risk, people who don't have a strong family history of ovarian cancer, people who don't have a BRCA mutation, they generally don't recommend screening for ovarian cancer because the things that we do, which would be ultrasound and a blood test called CA-125, have very high false positive rates. A lot of the things that you would pick up aren't ovarian cancer, but you might end up doing surgeries and other things thinking that people might have that. So they don't recommend screening routine people for ovarian cancer, although I think an annual or at least regular pelvic exam might give you the chance to pick things up. For women who are higher risk of getting ovarian cancer, people who have BRCA or other genetic mutations or a strong family history, they do recommend some kind of screening, which might involve an ultrasound once or twice a year and a blood test called CA-125, which ovarian cancer often has elevated. One other thing about cervical cancer, for women who have immunosuppression, women who have HIV and other things, they need to be screened at an earlier age because they have a much higher risk of getting cervical cancer. But for routine people, you don't start till the 21 to 25.
Great. Thank you so much. These have been really great questions, really great answers. I want to thank everyone for taking the time to join me today, and we'll see you next time on Healthier You right at home.